the Health and Human Services Committee meeting to order. I do not have anybody registered for public comment, but the chair is not here, so did you receive anything?
I did not.
And are there any callers on WebEx that wish to make public comment? Okay, then we'll move on to item 3, approval of the September 8th, 2021 Health and Human Services Committee meeting minutes. I will take a motion.
Supervisor Goddard, I make a motion to approve.
Do we have a second?
Second, Supervisor Gaber.
Thank you. All those in favor say aye. Aye.
Aye.
Aye.
Those opposed? Great, the minutes pass. Item number 4, the educational presentation and committee discussion. Item A, the Elevate Child Support Multi-Year Systems Change Grant presentation by Vicki Tilka. And Vicki, are you with us? Oh, is Kelly with us?
Yes, I am. Would you like me to get started?
Yes, take it away.
I can't.
Unless
I couldn't tell if Lance was there, if he wanted to say something.
he is here. Do you want to say anything? Okay, he says, Vicki, you can take it.
Okay, great. So I'm going to be turning this presentation over very shortly to Leah Griesbach, who's with us. And she is our grant coordinator for the Elevate program. And also with us, our child support manager, Kelly Gross. So we're really excited to be presenting about this Elevate grant and the opportunity it provides for Marathon County, but also the child support system as a whole. This is a systems change grant that we were asked to apply for based on our high performance in child support, meeting federal performance metrics, and also for the culture change that I'm going to attribute to Kelly Gross and her team over the last several years in terms of looking at changing the system of child support to be a friendlier, if you will, program to be able to support people who receive services, as well as to continue doing collections and establishing medical coverage for children and supporting family connections altogether, which is really the goal of child support. Unfortunately, over the years, sometimes child support gets a bad reputation. Sometimes people hear about the term of collecting like from deadbeat dads, which is really an unfortunate way to look at child support. So at the federal level and the state level, there's been a lot of resources that have put in to changing how child support functions, how it is seen, how it's recognized, and really, again, how it works to be more family friendly. So we're really excited to be part of this multi-year demonstration grant that Leah is going to talk about in more detail. So I will turn it over to her.
Thank you, Vicki. Are you guys able to see the PowerPoint, or should I wait?
We don't have a PowerPoint here in the chambers, or do we? We have one in the packet.
It's part of the packet if someone is able to put that up.
Okay, give us just a moment.
Thank you.
Thank you.
Okay, we have it up in here. Yep.
Okay,
Can you see that, Vicki?
Yes, we can see it.
Awesome. I'll go ahead and start. Good afternoon, everybody. As Vicki said, my name is Leah Griesbach, and I am the Elevate coordinator for Marathon County Child Support. First, I just want to take the opportunity to thank you for allowing me to speak with you about a program that I am very passionate about. The purpose of this presentation is to kind of give you a background of how Elevate came to be, how Marathon County has developed our model, and how we plan to move forward. So we can go ahead to the next slide, please. To start, I'm just going to give a little bit of background on the history of where this grant came from and where we're headed. In 2012, Wisconsin and 7 other states were selected to participate in something called the Child Support Non-Custodial Parent Demonstration. The goal of this program was to provide employment services so that we are able to connect with non-custodial parents in new ways. But offering this unique service showed improvement in relationships that were historically negative and one-sided, kind of how Vicki mentioned previously. So after 6 years, that program was adjusted, and then it was piloted in Brown and Kenosha counties, renamed Supporting Parents, Supporting Kids, SPSK. The thought was that if child support agencies saw success by offering employment services, then they could add to that and provide some wraparound services for an even greater impact. So beyond employment services that would directly relate to payments, they would be looking more at the broader family unit and improving relationships within families. The expanded program goals included enhanced case management, fatherhood and parenting activities, and child support state reduction and order adjustment. Since SPSK was deemed successful in Brown and Kenosha counties, the state then decided to add 3 additional counties, which would be Racine, Wood, and Marathon, to further refine a model that could potentially be replicated throughout the state. So that's really what we're working towards. BCS purposely chose counties that had a passion for invoking positive change and getting rid of some of those systemic barriers. And Marathon County was able to prove in our application that that shift had already started here. Selling the Elevate program to our staff was no challenge. In fact, we had already made changes under the leadership of Kelly that were consistent with the purpose of Elevate. You can slide down to the individual stability model. All 5 counties have actually chosen to use this model as a starting point and a resource for what needs to be addressed per individual and in what ideal order. Obviously, we're not able to always follow this to a T, but we do think that there is value in assessing individuals and supports that they're missing while keeping the order of this in mind in order to encourage customers to move forward so that they are intermittently able to focus on the last rung of that circle, which is personal growth. We believe that we need to start at the bottom and address the issues one by one. So very quickly, family is the underlying motivation and the only basic similarity for everyone that's involved in Elevate. Elevate is a voluntary program, so that is there. If they're open to working with me and our team to plan, overcome barriers, and move forward, then they are looking to better themselves, which will also improve the functionality of their family, so that piece will be there when they come in the door. Intermediate needs such as transportation, food, clothing, physical health care are some of the first thing that comes to mind when you see that second rung. But Elevate also believes that spending a great deal of time on housing, mental health care, those types of things will allow us to assist clients to kind of step out of a fight or flight type of mentality and into a space where they are then able to focus on employment and stability. Income support is a complicated portion of this circle. It sounds easy to assist customers with things like financial literacy, regaining driver's licenses, those types of things, but they can take quite a long time, depending on the severity of how much education needs to be there and how many things need to be addressed for that license, especially when a program like Elevate could potentially be as short as 3 to 6 months. Skill development could really be the point where Elevate would be able to see someone employed for 3 months and successfully disenroll. Success determined by BCS is clear. It's 3 months of continuous payments, but this is not where Marathon County will always choose to step out and disenroll. Career advancement builds on that last step and really moves it forward. In the last 1.5 years of work, we're starting to see enrollees move up in employment by securing assistant manager, supervisory roles, and we are hoping to see this pattern continue and amplify over the next 2.5 years with this implementation of the grant. That last rung that I mentioned previously can be very difficult to gauge, but it is possibly the most important for the individual experience. This could potentially mean that our assistance would allow for individuals to focus on things like life mapping and to have this underlying sense of hope. Most individuals in life, if they ever get to this point, you can't really stay here for too long because something will happen that will lead to a lower rung of the circle needing to be addressed. But the opportunity to work through that level, even for a short amount of time, is an ultimate big picture goal for Elevate. You can go ahead and slide down, thank you. Elevate focuses on these 4 services. The state has laid out these services as the necessary components for each model that is in development. So as long as the counties are compliant with these 4 things, they're able to really do what they think is necessary in their community, and hopefully have the data at the end to prove it. First, we start with enhanced case management. For Marathon County specifically, this involves facilitating a needs assessment, developing action plans, domestic violence screening, completing referrals to both internal and external services and resources, and provides an opportunity to set really clear expectations and responsibilities on behalf of both the participant and the Elevate staff. We also monitor participant success. For most enrollees, this involves touching base with us a couple of times a month so that we're able to hold that accountability that we're moving towards goals. For employment services, we first complete an employment needs assessment so that we're able to really decipher, is this individual ready for work? What type of work supports might they need, so that we can do as much as we can to see success from that. And beyond that, we assist with more traditional aspects of job searching, such as resume writing, job applications, job retention services, and providing educational opportunities for our enrollees. Parenting education and services. Every client that enrolls will complete an informal assessment of parenting needs and interests. Depending on the outcome of that conversation and individual circumstances, we will refer to and work with our parenting provider, who is Ruby Signs, in order to offer a parenting class and a workshop dependent on the children's ages. And this really allows parents in similar situations to come together and learn in a controlled environment and feel like they're given an opportunity to learn in a hands-on type of way. We continue our work with Ruby Signs with clients who need it also by providing supervised visitation. Lastly, we work with clients in our office to create parenting plans whenever possible, so that mediation and the cost that it involves can hopefully be circumvented. Lastly, our enhanced child support services. To give a little bit of background, individuals who aren't enrolled in Elevate, for them, the standard review process can take up to 6 months. And requires some paperwork and a potential demonstration of a significant, substantial change in circumstance. This, when enrollees are enrolled in Elevate, it's less formal and a more streamlined approach where child support can determine if an order is too high while maintaining compliance with statutory requirements. You can go ahead and slide down, please. Thank you. Measures of success. As you can see on the left, we are working with the Institute for Research on Poverty to gather data about the effectiveness of Elevate. For clients with current support orders, IRP offers a survey. It takes about 45 to 150 minutes, and it's over the phone. We do that in office, first time we meet with a client. The length of that survey, I know it's quite a large gap of time. It directly correlates with the number of cases in children that an individual has. This becomes complicated because individuals historically with more cases tend to have a negative relationship with child support and are less likely to engage. So it's just an additional barrier that we need to keep in mind and address in order to establish rapport with those clients. That's our pre-test version with our IRP. IRP then touches base with clients a year after they enroll in Elevate to address changes in circumstance, employment, and family dynamic that can potentially be attributed to Elevate, which would be our post-test. We are very passionate about working with IRP despite some of the things that I mentioned, the length of the survey, the parameters of eligibility, different things like that. Because high quality data about large, complex programs like Elevate really allows researchers to better isolate Elevate as the cause of these changes. Data also helps researchers learn more about how a program works and how it meets its goals. Data regarding which non-custodial parents received which services and by what mechanism will enable IRP to be able to tell us what kinds of employment and parenting interventions may support parents best and subsequently their non-custodial children the most. Let's see, sorry. Okay, so the data on the left, or that information in the left column, is really what the State and Institute for Research on Poverty are looking for when it comes to Elevate success. But Marathon County has chosen to expand on that and look at these additional points that are here on the right. Obviously, we focus on DCF's desired outcome, but we marry it with additional measures of success that have been encouraged by the state, but they need to be laid out by us. We don't always disenroll at the 3-month of paid child support. Like I said, we gauge parenting successes on a case-by-case basis, just due to the large array of situations and starting points that we see. And we also won't disenroll someone when they're in the middle of participating in our parenting curriculum. Another main thing that we love to see before disenrollment is that enhanced relationship with child support. That can sound kind of subjective, but at most times, members of our team are really able to see it as obvious. We want to have a positive relationship so that the customer knows if they need additional services in the future that we are here. You could slide, please. Here are our Marathon County specific numbers. These are very recent from the end of Q3, so that would be September 30th of 21. Our total number of enrollees since January 1st of 2020 would be 170. 126 of those took the survey. 68 of those are still active. 44 of those did not take the survey. 17 are still active. I would like to add a disclaimer that there was a brief period of time where the Institute for Research on Poverty was closed, and we chose to enroll without the survey in those specific situations. We have had 34 successful disenrollments so far, so that's about 39% of our individuals who are disenrolled. Another quick disclaimer is we had 3 additional successful disenrollments who found themselves needing our services again, who had re-enrolled, so they're not part of this number. We have had 12 participants in our parenting class, which involves 20 hours of classroom instruction, and then also 20 hours of one-on-one hands-on instruction. And we have 12 participants signed up for our next class that starts next week. So before the end of 2021, we should hopefully double that number. We have assisted 34.7% of enrollees with some form of parenting. 60.4% of our active enrollees are currently employed. Another unique thing that we saw we have now seen as a barrier that we didn't initially know about would be the number of individuals in our area, in our community, that have never been able to obtain a license. Most of the time, that's credited to either not being able to afford a driver's ed class, or that fees, or having a reliable vehicle to take the test at the DMV. Separate from those 23 individuals, we have helped 53 individuals regain driving privileges by ending suspensions and helping them to set up payment plans for their outstanding fines. The last interesting piece of data that we were able to look at the end of last quarter would be other counties and previous permutations of this grant had seen about 20% of their referrals actually enroll and engage in their programming. Marathon County has seen 45.33% of individuals do that. And I would love to credit that to our fantastic child support team who has supported Elevate since before day one, since before we were actually granted this opportunity. And also the work that we have done to create and maintain positive relationships with our child welfare and probation and parole teams. The last area where we are seeing a large increase in referrals would be word of mouth, which is fantastic because it really leads us to think that our community sees the value in a program such as Elevate, and we would love to continue. So you can slide down again. Thank you. That wraps up our model and how we think we have the biggest, or how we can have the biggest impact on our community. I'm going to end this afternoon with just a couple of success stories that will allow you to see kind of some different types of success and how we've worked with individuals. And these are the types of successes that are really motivating to us and our staff. So we hope that you find some enjoyment in them. Just a little disclaimer, the names have obviously been changed. We'll start with Amanda. She was one of the first individuals that was able to enroll in Elevate with some pretty significant barriers. Rural Marathon County, she did not have a license, so no access to public transportation. She also had a lack of employment experience. She was pretty young, but had never been employed anywhere for longer than about 3 months. And she was experiencing some parenting difficulties as well. While she was in Elevate, we were able to set her up with a driver's education program where she was able to get her temps and then her license. We assisted with some work supports like gas cards and different things like that to allow her to continue a work study program that she was previously involved in. When her work study program completed, she was hired on at the business that she was working at, and she's been there for over a year and is now the assistant manager. And she is exercising parenting time, and in addition, her contempt with child support has been dismissed. So we love to see that full wraparound type of experience. If you want to slide down to Craig, that would be great. Craig was kind of a completely different type of situation. He was in prison for the majority of his children's lives. When he was looking to re-engage with them and create that relationship, they were teenagers, or they are teenagers. He first was released from jail. He had been making payments, and he came to child support really looking for what he could do in terms of getting some type of face-to-face or messaging or any type of parenting type of relationship with these kids. He was referred to Elevate. He went through our parenting class. He did the full 10 weeks, and we were able to leverage that and talk with the custodial parent. She was obviously hesitant, but we were able to get him some supervised visitation time. Now, after a couple months of those supervised visitation times, we have a temporary short-term visitation plan that goes till the end of December. And we will be looking to help Craig file paperwork, have visitation written into a new order sometime early in January. Not everything with this case was perfect or easy. A couple of payments were missed. There were transportation barriers. The custodial parent was understandably pretty resistant, and the children were cautious and slow in kind of creating that relationship and expressing their desire to maintain it. But when we look at the whole picture, we've assisted 2 teenagers to expand a support system. We can never have too many people that love us. And we've provided an opportunity for Craig to put his words into action and to be a dad in a way that his children are really comfortable with. So we love to see that also. And then I just have one more, if you don't mind. Andrew is a situation that we see in child support very frequently. He had a large amount of, or does have a large amount of child support cases, which inherently can mean a larger monthly support obligation, a fairly large obligation. A decades-long negative relationship with Marathon County Child Support, combined with an inconsistent work history, kind of made him an ideal Elevate candidate, but it was really a lot to work through to establish that rapport. He is currently working and making payments, which members of our team have expressed a great joy at. He is utilizing a community program for transportation to and from work, although we did help him to obtain a license. He is saving for a vehicle. He now has a much more positive relationship when he calls into the office, asks questions, and interacts with our staff. Before we would look to disenroll Andrew, we would really be looking to address kind of our last barrier, which would be job hopping or a hesitancy to move on from temp agencies into something more permanent. So we're hoping that that follows in our general direction of the way that we're heading, and we'll be able to successfully disenroll in a few months. Vicky's now going to take over and speak on the new position that we're requesting, which will allow us to really capitalize on our past success and allow our caseload and offerings to grow. So thank you for your time, and I look forward to my next 2.5 years refining our Elevate model in Marathon County.
Thank you, Leah. We can go on to the next last slide there. Oh, sorry. Shouldn't have. Are you able to share again?
Yep.
Thank you.
Not sure if we're going to get it back, Vicky.
Sorry,
Okay.
Vicky, it's not responding.
Okay. I don't know if I have a copy of that hard plan in front of me here, Leah, so I might need some of your help here.
Right.
We looked at what we want to move forward in 2022 and expand some services. We are looking at expanding parenting services even further and looking at incorporating some individuals who are incarcerated in Marathon County Jail with basically trying to enroll them in Elevate as well as parenting classes to make them be eligible, and hoping that we could use work release at times for them to have some of the experiences and potentially even have classes in jail. So those are a couple of the focus areas that we're looking at. Continue to expand our enrollment and work with those who are also continue to be enrolled. Was there anything else, Leah, that I was missing before I move on to specific the grant amount and just reference the position?
It's beautiful, Vicki. Great memory.
Okay, great. Thank you. So as we have talked about, this is a multi-year grant, and we have received a large portion of money already for the grant, and we've actually continued to get different pockets of money for various purposes because of our performance. So while funding is guaranteed for 5 years, what we want to let you know is that we've also received additional funding of above and beyond what our original offer was. And one of that pots of money is to expand a case management position, which we are moving forward in the next agenda item to ask for that new position request that's fully funded. And now that you've seen the outcomes from our work with the grant, you can understand why we were offered this money throughout 2022 with not a strong commitment, but I would say a likelihood of it being re-upped because they're very happy with our results, the amount of people we've enrolled, but also our outcomes. So again, something to really be proud of, and we're definitely being rewarded and incentivized with additional dollars to expand the program. So that ends the presentation.
Okay. Any questions from committee members for either Vicky or Leah on it? Thank you for the presentation, by the way. Yes, go ahead.
I just wanted to say that you guys are pretty awesome, and it is really exciting to see the success that we've had in Marathon County versus the other counties. So I want to just congratulate you for that, and I'm looking forward to seeing what we can do in the next 2.5 years.
Thank you.
So you would say that we are on track for participation? We're just looking at total number of enrollees through September at 170. That is on track? That's where we expected to be, or are we actually exceeding expectation on that?
As I mentioned, there was a point last year where the Institute for Research on Poverty wasn't able to take enrollments in the same type of way. But to kind of give you a frame of reference, our first 2 quarters of this year, we hit. So our goal was 26. First and second quarter, we got 26. Our third quarter goal was 26, and we had 34. So we're really building upon our enrollments, and we're really getting to the point where we're able to efficiently move people forward in larger amounts of participants at the same time.
And I would just add to that and also say that we were one of 2 counties to hit our actual enrollment target despite the pandemic, which was an impediment to a number of counties in terms of enrolling people. And we were the only first generational county to be able to do that. So we were very, very pleased with our result, and Leah gets a lot of that credit.
All right. Other questions from committee members? Well, seeing none, thank you both for the presentation. It's very informative, good update on this, and good to see some grant money going for a very positive use. And hopefully we can continue that going forward. So thank you.
Thank you.
Thank you.
All right. Then we will move on to item 5, operational functions and required by statute, ordinance, or resolution. 5A is requesting a 1.0 full-time equivalent social service coordinator grant-funded position effective 10/21. And that's in direct relation to the presentation that was just done. So,
Sure. Thank you, Mr. Chair. And this, I'll just tee up just for real quickly, and then you guys can ask any questions of Vicky you may have. But again, in terms of process, your ordinance provides a very detailed process as to how a new position requests should be made. The document has been reviewed by administration. I support the request. Within section 4.20, it provides a specific time frame on any new positions outside of the Marathon County budget process. And this position, as Vicky will talk about, came in outside of that. However, because it's fully grant funded, there's an exception within your process through section 4.20 of your ordinances that it can be brought to HR, Finance, and Property outside of that March and August timeframe. So the next step, should you wish to move this position forward, would be for you to make a recommendation for this to be brought to the HR, Finance, and Property Committee for review. Thank you.
okay. All right, committee members, I'd be looking for a motion then to take this forward to finance. Okay, I have a motion from Supervisor Van Cree. Do I have a second?
Supervisor Gondring, I second the motion.
Okay, we have a motion and a second to approve the social service coordinator grant-funded position effective 10/21 to approve it at this level and forward it on to Finance and Human Resources. Any further discussion on this? All right, seeing none, all in favor say aye. Aye.
Aye.
Aye.
Opposed? The motion is carried. So, thank you. All right. On to item 6 then, policy issues, discussion, and potential committee determination. 6A is a recommendation from NCCSP Board to reduce Mount View Care Center nursing home licensure to 154 beds. And Administrator Leonard, you have some comments on that?
Sure. Well, I'll just introduce the person who's going to make the presentation to you. So as you recall, you are the Committee of Governance under your rules, under Chapter 2 of the Marathon County Code of Ordinances for issues relating to North Central Healthcare. And Jarrett Nickel is here from North Central Healthcare because as many of you are aware, I think all of you are aware, there's considerable renovation work being done to North Central Healthcare. And one of the remaining phases relates to renovation of the existing Mount View Care Center for purposes of continued use for a nursing home, specifically the second floor. And that issue is before you today. There was the ribbon cutting actually for the nursing home tower yesterday, a 96 bed facility. But Jarrett's going to walk you through kind of where we are in the project and where the market is with respect to nursing home care and why the consultant that North Central Healthcare has engaged in this process is making a recommendation relative to bed licensure and why the North Central Community Services Program Board is sharing in that recommendation. But that is a significant issue for Marathon County as it does operate Mount View Care Center. So with that, Jarrett, that's a little tee up for you, and I'm sure you can take it away. And then anyone, certainly, if you have any questions, feel free to ask them at that time.
All right, great. Thank you, Lance. Appreciate the introduction. And thank you to the committee for allowing me to speak today regarding the Mount View bed licensure. So included in your packet is a memorandum speaking to this. So I'll kind of walk through that as well as provide a little more detail on a few topics here. So as Lance had brought forward, we did just complete the 96 bed, what's referenced as our nursing tower. So with that, all 96 beds are private rooms. With those private rooms, our occupancy max in that building is 96 due to inability to move those to semi-private due to the size of the room. So we're at the 96, are unable to have any more rooms in that tower. So with that, where the remaining beds really come from is our current Mount View Care Center building, 2400 Marshall Street. We have the second floor of that building that was designated to have resident rooms on it. In 2017 and 2018, when this plan was originally envisioned, the thought was 172 beds in total, 96 of those in the tower, and then the remaining on the second floor of Mount View Care Center. With that, the thought was to have a number of still semi-private rooms. With that, in the renovation plans that we've been working on over the last few months, those semi-private rooms really have little to no demand. So the thought is to make those private rooms so that way we're able to ensure those beds are filled. Having a vacant or an open bed has no benefit to the organization, to the community, anything like that. It just has a cost of $170 per month. So this also is financially driven as well as just again from a demand of the community. So 154 beds is the actual physical number of rooms that we would end up with after all the renovation phasing is complete. Our current number is 188, so that'd be a reduction of 34 beds. At that $170 rate would be $69,360 annually. Included in your packet is the why behind it. On the second page of the document or the memorandum, on the second table, you'll see a comparison for skilled nursing facilities in our area. So the top one listed there is Mount View Care Center. You can see the ownership type. Then you can see the year that the original building was open. It doesn't necessarily dictate any renovations or anything like that. You'll see the number of beds in service. The reason our number is not the 188 is we do have them in what's called a reserve capacity. We did that in order to proceed with the renovation. And then you can see the current occupancy percentage of that amount. So you can see our occupancy percentage in the county stays relatively close to that 65 to 70 percentile. So you can see there's a number of other facilities in the county with open beds availability. And you can see a little bit more of what their average daily rate is. And then the final one is the 5-star quality rating, which all have different indications, but really the column to focus in on is the number of beds and the occupancy percentage. So we believe with this move, we'll still be able to serve the needs of our community, be able to provide the services that we do today, as well as be more financially cognizant with the reduction in the number of licensed beds. Again, if they're not occupied, you still have to pay that $170 per month per bed. That's all I had for the presentation.
Okay. So, yeah, we've got a couple of questions, I'm sure, on this. Supervisor Robinson is here for one, but Lance, do you have something
Sure.
you'd like to?
Jared, I don't know if you want to cover for the committee, what, if any, impact does retaining those licensed beds have if you utilize them for double occupancy? What impact does that have on your ability to receive reimbursement for the rest of the beds?
Yeah, so there's a few different caveats with this. So we have to have the number of rooms that we have licensure. So we wouldn't have the ability to carry a license of 172 if we only have 154 rooms. So to what Lance's point is, we do have to carry then a number of those rooms at double occupancy, which is then a burden. If we're not able to fill those with double occupancy, we're sitting again on licensure at that point. So there's kind of a twofold that you can't just carry licenses if you don't have the beds out there. The other part is for Medicaid, based upon your occupancy percentage, there's an item called a bed hold. So if someone goes out to the hospital, Medicaid will pay for the bed if you have an occupancy percentage of 90% or higher. Again, it's based on your license number of beds. So again, if we're carrying an occupancy or a vacancy rate higher than that, we're not going to get paid. for that amount, and that's per day, and it's right around, I think, 150, 160. I can get exact statistics on that, but again, you would lose out on that as well. So there's a few financial negatives to that. Again, understanding that it depends on the direction that this committee takes on that, but just kind of the pros and cons to the 154, 172, and 188 numbers.
Okay. Okay, thank you. Supervisor Robinson, you. I don't think it's on.
Thank you, Chair
Oh, there you
Butke. I'm here today out of concerns over the potential ramifications of reducing the beds, and the concerns were raised by members of the community. My mother is a resident of Benedictine. We couldn't get her into North Central Healthcare years ago and wound up at Benedictine, and she's happy there. But in talking with the discharge planner at Benedictine, he expressed concerns over any reduction in bed and the impact upon our ability in this community to service people with memory care or dementia. And the role of North Central Healthcare is critical. And I also talked with Jennifer Schradel, who's she contacted me. She's a discharge planner for Aspirus, and I thought she might be here today. And they're concerned that again, North Central is one of the few facilities that accepts memory care patients. Colonial Manor used to, they no longer do, and there is a shortage of beds. And it results in many cases delays in discharging or discharge outside of this community to a Colonial Center in Colby, outside of the area. I just urge caution until we understand this memory care area, and I can speak firsthand. I know that I have acquaintances whose family members are struggling with, do they put their parents into a nursing home in this COVID environment? We're fortunate that my mother is in one, but many times the visitations are through the window, and people don't want that separation with their family. I'm just concerned, given the silver tsunami, the aging population, the increased demands of memory care, of whether or not this bed reduction is short-sighted and will need to be revisited. If we reduce the beds, I have a question. If we reduce the number of beds, what is the process for expanding should we go forward in the future?
I can speak to that. So once the beds are given up, there is no ability to get them back at this point in time. The state's identified that there is a oversupply of beds. So at this point in time, the only way to get beds back would be to purchase them from another provider. And that provider would have to be in our community or county or an adjacent county. So once they're given up, they're sent to the state. Again, it doesn't mean in a few years they won't open it up, but at this time, to answer your question, there wouldn't be the availability without purchase.
Again, with that in mind, I would urge caution relative to the reduction of beds, and I would strongly suggest that we reach out to those discharge planners at Marshfield and at Aspirus to make sure that they're comfortable with our reduction. I wouldn't want to put us in a position where we're not able to meet the demands, and I think this could be done quickly. The bed taxes is one thing, but not having the capacity to deal with the specialty population, which is one of the reasons that we came up with a recommendation to remodel the nursing home as part of the task force, and Chair Butke was part of that. And we made the recommendation for the larger number of beds, but we've been slowly over the years reducing the number of beds at North Central, and the question is what's the appropriate level? And just based upon the concerns that I had from a nursing home that is, who does the transition from the hospital to the healthcare, and the concerns over the lack of beds, and the hospital discharge planner, I think that caution would be wise at this time.
Thank you for your input, Supervisor Robinson. Any other thoughts from committee members on this?
have a question.
Supervisor Van Crane.
I just want to make sure I understand how this works. So the recommended number of bed licenses would be 154, but then for 2022, you'd be only recommending that 136 of those would be used because of construction and staffing and COVID. And then for 2023, you would increase that number to be used to the full 154. Am I reading that correctly?
Yeah, that's correct, pending COVID recovery. Yep.
Okay, thank you.
I had a question regarding this as well, because there are certain services that really only the county, the government can provide, right? That some of the other senior living facilities don't. I mean, does this potential move somehow jeopardize that that service that only North Central is providing?
Are you referencing memory care?
Well, that perhaps, and among other things. But Supervisor Robinson, you have.
Well, I think when we had the task force in the nursing home, we struggled with directionally where do we go, and is there a role for the North Central Healthcare in the county to be engaged in the nursing home business? And one of the compelling reasons was those people that we did under protective placements, and having the need here to address that, and that if we have a responsibility for those. But I think there was also the recognition that we wind up being the provider of last resort due to Medicaid's inadequacy in reimbursing the rates, and I think you've seen a number of nursing homes fold because they can't make it in the current financial environment where state Medicaid reimbursement is so low, and that's a separate issue from what we need to do. And I just, my reason for being here, and I perhaps should have been involved earlier, but it was brought to my attention recently by the discharge planners, is are we taking a resource that we may, are we decreasing the number of beds only to have to revisit the issue in a reasonable period of time? And I think that COVID has just changed the dynamics. I know there's trends of trying to get people into their homes, but I think if you've got someone in the memory care area, it is very difficult to have out of home or out of nursing home placement for many of those individuals.
Administrator Leonard?
Jarrett, did you want to address how the recommendation impacts the number of memory care beds? And then I have one other request. And I apologize, I didn't do a good job of framing this up, but one of the impetus to this recommendation and for consideration today is the utilization of the consultant that you reached out to, Clifton Larson Allen. You want to talk through both those issues, how the recommendation impacts the number of memory care beds from current state and then in future state, and then also the information that you gained from Clifton Larson Allen.
Yep, I can speak to both of those. So from a memory care standpoint, we are actually not reducing any memory care beds. All of our reduction comes in what's referred to as long-term care beds. That's where we're seeing people move to assisted living facilities. Home health care is starting to raise their acuity levels or ability to take care of people at a much more challenging rate than they were before, similar to what we've done in regards to people coming from the hospital to us sicker. So we wouldn't be shrinking any memory care beds. It's truly just the long-term care beds, which again is where there's least demand out there for. With that though, the table in your packet is from Clifton Larson Allen. So North Central Healthcare hired Clifton Larson Allen to complete a study related to what's the appropriate bed size for our county, Marathon County, as well as the surrounding counties. Fortunate that we are managing Pinecrest at this time, so we did a deeper study as well into Lincoln County. However, focusing on Marathon County, what came back in that study was a recommendation to reduce the number of beds due to demand. This is unrelated to COVID-19. This is prior to COVID-19 pandemic occurring. And the reason for that reduction is, I think it was referenced the silver tsunami. That isn't occurring. That isn't something that we're seeing. Those numbers are actually decreasing. And the reason for that really is related to hospital length of stay is shorter than it used to be. Even our skilled nursing length of stay is shorter than it used to be. You're seeing people that are being able to manage a lot more of their needs at home health. So really the healthcare sector is changing. And with that, the perceived need for skilled nursing is lessened. So for example, we operate community-based residential facilities or a type of assisted living. We're able now to do Hoyer lifts and to do wound care, which is things 5 years ago never would have been thought of in those type of facilities. Those would have only been done in skilled nursing facilities. So that's the other challenge, and that's at a cheaper rate to both the government as well as to private payers. So a lot of people choose to go to those settings because of cost, because there isn't as high acuity abilities that we would be able to, or requirements that are in the skilled nursing. So that's how Clifton Larson Allen came up with that study. Again, it is a study. It is done by Clifton Larson Allen, who does have a number of resources and everything, but it doesn't mean that's exactly what will happen. It's just what the prediction that they have in the next 5 to 10 years.
All right. Yes, they were involved with us as well as we were planning, the facility changes and everything, and that's how we got to where we're, the number of beds we're at today. So, other thoughts from committee members? It's one thing that stood out. Well, go ahead, Supervisor Robbins.
I apologize for speaking a third time, but my suggestion would be for you to do some outreach with those discharge planners from the other institutions to see if they're in agreement, and maybe lay this on the table until the next month to see if they have some concerns that were not factored in. While the data from Clifton Larson and Allen did good work and they were involved in the original report, but there's a number of facilities that are missing in this report. And I think we want to make sure that we're capturing the fact that Colonial Manor no longer provides the service, and others. We don't want to create a problem, an unintentional problem based upon incomplete information. And again, I would strongly encourage reaching out to the discharge planners at the healthcare institutions that have raised issues to me about the need for those beds.
I would concur with that. I actually talked with a couple of physicians when I mentioned that this was on the agenda today, and they immediately were concerned about it. And I think we should go about this cautiously. Maybe this makes sense, but that's my opinion. So, but I would leave it up. Any other questions from the committee? Administrator Leonard.
Thank you, Mr. Chair. So what I hear just in terms of, at least right now, unless there's some opposing direction, is that desire to reach out to, first and foremost, some discharge planners through local health systems. Is there any additional information that the committee would like North Central to working with the county to procure, to make sure that you have all the information you need to make a determination, a recommendation to the full board to move forward?
Is there like a study or some sort of documentation that they provided to say that they didn't believe that the silver tsunami, increase in demand would not be happening? If we could have access to that, if it exists.
Jarrett, that was a presentation they made to the full North Central Healthcare Board at its recent retreat, correct? Related to a little bit of that?
Correct. Yeah, I have an electronic copy and would be willing to provide to whoever would like that. I can definitely make that a document, whatever is the appropriate way to go through it for this committee.
Great.
Okay. All right. Other thoughts from committee members? I guess I'd have to ask then, what's your pleasure at this point? Either, to accept this, go forward, possibly to table, get more information. How would you like to proceed?
I'll make a motion do you have a suggestion?
If I may, Mr. Chair, I know that it's been done in the past, and Corp Counsel sitting in the back to make a formal motion to table. I'd hate for you to make a motion to table the next month and we find out that we need more time to get you the things you need. I'm confident we can do that. I have no reason to believe otherwise, but I do want to sit down and talk with Jarrett to see if that's a reasonable thing to do. So correct me if I'm wrong, Mike, if you have a different approach, but I would like to, with general consensus from the body, that we can bring this information back next time for you to act on. I don't feel like we need
Okay.
formal action. I see Corp Counsel nodding his head, which I take as formal opinion.
I'm fine with that, because I think we're all in general understanding. I just think we need a little more meat to the bone here to make a informed decision. So,
And if you do have it, I just want to make clear I understand and that Jarrett and I understand what you need, so that we don't come back with additional information next week or next month rather, and there are additional concerns that you have. If, to the greatest extent you can, I appreciate if you voice any of those concerns. If something comes up after the meeting, I totally appreciate that. Just please reach out to myself
yeah,
or Tasha, and we'll get in contact with Jarrett.
we will do that.
Does that sound feasible, Jarrett? You and I can speak after this meeting sometime and start to get that information together?
Sounds great to me.
All right, thank you.
Very good, thank you. All right. Any other comments on item 6A? All right, thank you. Item 7 then, is next meeting time, location, and agenda items. Committee members are asked to bring ideas for future discussion. I did say last month that we were going to be talking about our strategic plan and how we fit into that and so forth. We weren't quite ready to do that yet. We will have that on the agenda for November, though, and hopefully with the spreadsheet and everything laid out on that. And I would encourage committee members to share their ideas on that as well. So, any other thoughts from committee members? All right, the next scheduled meeting is November 3rd, 2021 at 4 o'clock. So with that, I would move on to item 8. Do I have a motion to adjourn? Okay, I have a motion. Do I have a second?
Second, Kelly Gaber.
Okay, we have a motion, a second to adjourn. All in favor say aye. Aye.
Aye.
Aye.
Opposed? The motion is carried. Thank you very much.